This week on the Wheelhouse. Police use of force. Who's disproportionately impacted? What can be done? And gridlock in D.C. For Connecticut Public, I'm Frankie Graziano. This is the Wheelhouse, the show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond right here. Researchers at UConn have access to data that other states don't capture. And because of that, they know a lot about policing and its impact on the people in the community. These efforts reveal what many advocates for criminal justice reform have been saying for years, that police use of force disproportionately impacts Black residents. This hour, we'll dive into the numbers and learn more about what lawmakers can do with them. But first, the federal government shutdown continues, and as it does, we have an update on how it's being viewed right here in Connecticut. Lisa Hagen, federal policy reporter for Connecticut Public and Connecticut Mirror, joins us now on the Wheelhouse. Lisa, thank you so much for being here. So good to see you this morning.
Hey, Frankie, it's great to be back.
It's great to see you, and I hope you're coming with good news. I want to know, what's the latest on the shutdown, Lisa? You're down there on Capitol Hill, whatever Congress's version, maybe of the Vatican white smoke versus gray smoke is. Are you picking up any signs that deliberations are sort of ending here?
I don't have a great metaphor for you in that way. No, we're still down in D.C. and in Congress. There is still a stalemate. Plenty to dive into and what it's going to mean, but both sides remain at an impasse. They are dug in. The shutdown is dragging on. I think it's now hit the second longest, and it's, we still got days for not knowing what's going to happen.
I think I did this with you on the phone a couple of weeks ago. Let's try to help the viewers and listeners here understand what might happen that'll kind of give us maybe that white smoke or gray smoke kind of thing. Would it be lawmakers working together? Obviously, it's going to have to be working together, but not necessarily votes happening, but maybe people gathering in like working groups.
Yeah, I mean, it seems like there's no significant negotiations going on at this moment. Obviously, that is what lawmakers would like to see and do, obviously, to get out of this impasse and the standoff. It remains to be seen whether that can happen. We're seeing, at least this week, some votes will be taken in a way that can maybe try to get past the gridlock, but it wouldn't necessarily open up the full government. There might be a vote coming tomorrow on paying essential workers now. Basically, everyone's waiting on back pay. Again, I don't expect much movement on that, but they're definitely trying to find new strategies for a way out of this. But, I think you and I talked about this. It's possible that if this just keeps dragging on, will there be external pressure, things happening just, outside of everyone's control because there's not government funding that could maybe unlock this? It remains to be seen.
Dug in. That is a big turn of phrase that we're hearing here from Lisa Hagen, with them being dug in. I'm interested in hearing what our federal delegation is saying about the shutdown. What are one or two hard lines maybe they're taking here? When I talk about our federal delegation, of course, I'm talking about DeLauro, Courtney, Himes. And I try to do this game where I can name everybody, but I can't always do it. And then, of course, you have Johanna Hayes, Rosa DeLauro, the whole gang there, our congressional delegation.
They're all on the same page. They're all fighting for basically these expiring healthcare subsidies. It's people who are on the Obamacare Affordable Care Act exchanges who get these, again, subsidies to cover parts of their premiums. And basically, if those subsidies expire at the end of the year, premiums will skyrocket in a bunch of different ways. I'd actually seen a report that I think the 4th Congressional District, which is represented by Jim Himes in the Southwest corner, that could see some of the largest premium spikes in the country. And so that is what they're pressing. They'd also like to see, these Medicaid cuts that are coming in the future from the Big Beautiful Bill. They would like to see those reversed. I think that's a little bit harder of a play. So I think they're really kind of focusing on these ACA subsidies. That's an immediate concern. That would be these immediate cuts coming in the near future. And they also want to, try to ensure that President Trump and his administration can't overrule Congress's spending authority. So there's, it's a two, threefold kind of strategy, but they're really kind of focusing on the healthcare messaging.
You recently met a nurse down there that actually works here at Bacchus Hospital. Who is she and what did she have to say about the government shutdown?
She's worried again about this kind of twofold healthcare crisis that's unfolding. One, again, worried about Medicaid cuts. We don't know when exactly those are going to come, sometime in the near to, 2, 3 years down the line. She's also worried about the fact that there is a shutdown happening and that there could be spikes in premiums. But, for her hospital specifically, and this was, prior to all of this, there was a lot of shortages with staff and stuff like that, and so they're just worried that with changes coming to healthcare at the federal level, this could just continue to have a ripple effect in healthcare across Connecticut.
Affordable health care tax credits at the center of this fight, as you mentioned earlier, Lisa. According to NPR, Republicans argue this could be hammered out after Republicans or after lawmakers work to end the shutdown. Sorry. Democrats disagree. What other business in Connecticut and beyond might be sort of stuck in queue here until the shutdown ends?
Yeah, that's definitely the big one. I mean, exactly as you said, Republicans want to handle it as a standalone measure. I think they've already kind of tried to offer that, saying, hey, we'll, at least in the Senate, we'll take a vote on this if you allow the government to open up and just vote on this bill that doesn't include healthcare messages or healthcare policies. Democrats are pretty firm on that they want to tie this together and keep them coupled together. And so that's at a stalemate. I mean, just funding each agency is at a stalemate. I mean, again, what we're talking about when we're, in this current shutdown fight is just keeping the government funded at current levels. That's from a previous, fiscal year. This was during the Biden administration. What's currently at stake and is not moving is just completely new funding for the government for all 12 different agencies for fiscal year 2026. So that's completely at a standstill. And then, you're going to see if there's no movement on this, if we continue in a shutdown, there'd be a backlog. There's also the annual defense policy bill, the NDAA, that always gets pretty much punted to the end of the year, that always gets dealt with kind of in December. Still possible that will get handled at the end of the year around the holidays. But, again, with really business happening in Congress right now, the Senate continuously taking votes on the same bill, the House not even in session right now. It's just a backlog in Congress.
Let's sort of demystify this for people for a second, because the argument is always going to be around who's got the power in D.C., the balance of power. But just in this particular case, and this is why Democrats are getting blamed for a lot of it, but we're going to demystify this for folks, I think, just to help people understand. You need, in order to get this through the Senate, you're going to need 60 votes, right?
Yes.
So they kind of have to have a bipartisan agreement.
Yes. And that is why the Senate is the key to all of this, because you can get things through in a simple majority in the House, which is what they already did, and not on final passage. You can get a simple majority, but to do, in these wonky terms, it's a cloture vote and it's getting, past the filibuster, but you need 60 votes and there are not 60 Republicans. That's why you need Democratic votes.
And then for Democrats, if somebody were to say, hey, because you need the 60 votes, it's their fault, they should just agree with it with the Republicans. Well, they would say not so fast. We have our own policies that we want to try to push through, and we're really concerned about those healthcare premiums. And then you have what Senator Murphy has told, I think, both of us. His concern is that any kind of funding that you give the Trump administration at this point, you're not sure where that might go. That was a big worry that he had when he came on the show. And that could be particularly a big concern when you're talking about federal troops, or at least the National Guard showing up in places and things like that. Is the concern that Democrats have that if they fund the government, it could be used sort of elsewhere? The money that they release to the federal government?
Yeah, and I think it gets lost in all of this because, again, Democrats are really hyper focused on the healthcare messaging and trying to extend these healthcare subsidies. But that, again, that is a part of their shutdown approach as well, is trying to pressure the administration and saying, hey, we have, it's the power of the purse. We hear that term a lot. Congress has the authority to spend and approve money the way they see fit. And, a lot of this money that's already been approved by Congress in previous years is not being spent at all, is being moved around by the administration. So they just want to ensure that hey, we're going to approve this money, it's going to be used the way we intended. And so that is a part of the strategy. I know there's some, frustration even from Republican appropriators, the ones who get to make all these decisions. They want to also, have their money spent in such a way. But that is also approach to this. But again, a lot of this has just been kind of taking a back seat to the healthcare messaging.
And then, as we kind of mentioned earlier, many Republicans would say, "Hey, you could just probably do a CR, and then we can move on to other business." Is that kind of what they're thinking at this point?
Yeah, I mean, they're already having to maybe change and revise plans. I mean, the CR, the continuing resolution, again,
Thank you.
that's what keeps the
Drink.
bill. Yeah, just always got to demystify the terms, but yeah. So this continuing resolution, which we keep again flat funding, it was to go to November 21st. I mean, we're already a month away from that. They're already talking about needing to come back and extend it a little bit longer. There's talks from Republicans about just doing a full year CR. They've done that in the past. That's pretty much what they did to get us to the current situation, current month right now. But I don't know where it's going to land. It's possible that Congress can keep deciding to fund things the way they've been funded and not do new funding. And that sometimes can amount to funding cuts because a lot of the times when you get to a new fiscal year, you are increasing funding in some ways. And so it's unclear how long we're just going to keep operating on these short-term bills.
I don't know where it's going to land either, but I'm glad that we have you here to talk about it because we're on a roll here trying to just try to break this down for the regular Connecticut resident or the regular America for people to understand. So let's now talk back about the back pay. I think you mentioned that this is something that not just necessarily the back pay, but there's also an effort underway within the federal government to try to make sure that essential workers get paid and continue to get paid. Can you give us an update on that? What about pay for military workers?
Yes. So typically in a shutdown, there's people who are furloughed because they are not considered essential and they will not be working. They will not get back pay or they will get back pay once the government opens. There are a number of essential workers, TSA agents, those in the military. There's others that are just deemed necessary who are federal employees that continue to work throughout a shutdown and do not get paid until the government shutdown ends. And so there have been efforts among the Trump administration to try to move money around, keep certain programs funded, like WIC. It's the Women, Infant, and Children's Nutrition Assistance Program. They have tried to keep that afloat. Connecticut has done the same as well. There's also been, movement of trying to move money around to pay active duty military who, again, are working without pay currently. Is my understanding they did not miss their most recent paycheck. It's unclear if, when we get to the next paycheck, if they will also be able to fund that. And so there's an effort in Congress right now to try, at least in the Senate side, to try to pay essential workers, to give them the back pay that they've missed, and to keep paying them as a shutdown goes on. I don't know where that's going to land. Democrats are already wary of that effort because they say, specifically, Senator Murphy said that he doesn't know if that's going to mean that President Trump can pick or choose who gets paid, who's deemed essential during a shutdown. But at least that's the movement right now. And so, we'll see how that lands probably tomorrow. But there's at least an effort to try to pay some people while we're in a shutdown.
We often talk during a shutdown, and I've been there when it's happened. When the last one happened in 18 and 19, I believe it was, the government shutdown. We often talk about the U.S. Coast Guard Academy in New London, and workers there are generally missing out on pay in the absence of government funding. What can you tell us about local efforts to maybe support those families and even other families who are federal workers on furlough?
Yeah, I've talked to Connecticut Food Share about this. They were pretty integral last time in the 2018, 2019 shutdown. And so they were doing these mobile pop-up food trucks going to specific areas in the state where there is a little bit more of a federal workforce. Again, a lot of those essential employees who are working during a shutdown and not getting paid. And so they had said, similar to last time, they were up at Bradley. They were bringing, the mobile pop-up trucks up there. They had food boxes at Tweed in New Haven. And so there's already efforts to try to provide food and some kind of help to these workers who are having to just, again, work without pay. Also some efforts down at the Coast Guard Academy, even though it's my understanding that the Coast Guard at least got their most recent paycheck. And so, I think in all of this, as we, again, we're we're at the point where this is the second longest shutdown. It's possible we can get to the longest if we cross that 35-day mark. But we could
Oh
talk more
boy.
about this. But November 1st is going to be the real big marker of where we could start to see
What's November
not just
1st?
people missing. Well, we'd see not just people missing paychecks, but we would see SNAP potentially running out in Connecticut. They've already warned about that. Heating assistance through LIHEAP could also run out. And there's also concern of these Head Start early childhood programs also running out of money. But SNAP is really the big one. And so I think everyone's looking to November 1st of, is there going to be a breakthrough, or are people beyond just the federal workforce really going to feel these cuts?
We'll continue to monitor that because that's going to be important. That's something called a pressure point, and you mentioned that earlier. I want to kind of focus in on those pressure points, at least in this last question that I'm going to ask you. We talked about signals from lawmakers earlier regarding a potential deal. Those are some that you mentioned for November 1st. What are some other ones that get maybe regular people like you and I, or people that are not lawmakers that are up in arms, that could make us everybody up in arms here?
Well, again, November 1st is going to be a real crucial one. Again, you're going to see, especially, lower income families. And again, these are not necessarily federal workers at all, but people losing nutrition assistance, people potentially losing energy assistance, or, their childcare. Beyond that, I mean, I think I even saw this morning that some airports are just seeing a lot of delays. TSA workers, they're just air traffic controllers, they just might not show up for work because they're getting paid, or they're sick, or they need to take time off and they're not getting paid. And so you're going to see some of those residual effects. And as we get, we're about a month away from Thanksgiving, holiday travel is just going to ramp up. That could have a pretty catastrophic effect if people all over the country are trying to travel and can't because there's major delays. And travel tends to be a pretty big pressure point in shutdowns.
It's the year of the air traffic control worker, if you think about it. We remember how tough people were thinking that life could be when you had that plane crash in Washington, D.C. earlier in the year involving the military plane. And that might just be the beginning of it for those folks, because now some of them are not necessarily getting paid during the government shutdown. So, again, a situation where the holidays are coming up. That's something that maybe you're pointing to here. Thanksgiving. Obviously, the December holidays as well. Now you're having that happen, and potentially people having to call out of work. But I guess what the most important thing that you mentioned there in terms of November 1, I don't want you to have to speculate on this, but LIHEAP is a big thing that you brought up there. We don't even know about the future of that program and whether or not energy assistance will keep going on, and there's SNAP benefits, which people have been talking about, and those kind of dwindling. So, do we know anything about a willingness from congressional Republicans to maybe keep those programs in place? We know that they're maybe talking about some kind of WIC funding and extending that during the shutdown. Is there any kind of urgency to keep those programs here in LIHEAP and SNAP?
Right. And again, as you said, they've moved money around for WIC. It's unclear if they have the funding or the willingness at the federal level to keep those programs running. At least, the Department of Agriculture is the one that's kind of running SNAP, and they've just indicated to states, including Connecticut, saying the funding is going to run out in about 2 weeks, and we're not going to be able to pay out benefits that would start November 1st. These are monthly benefits. And so it's really, if the federal government cannot find a way to cover these programs, to keep them afloat, the onus, once again, is going to be on Connecticut to see whether they can keep it afloat and if they can keep things running. There is a willingness, and there's conversations from state officials to try to figure out what they can do. It's the possibility that the state could front the money, get reimbursements. That is unclear in all of this. They're already kind of doing that for WIC. And so, again, this November 1st deadline is pretty crucial. It could be a pressure point, but I think it's when you're really going to see the true full force, the brunt of the shutdown on not just federal employees, and then in some ways people not going to national parks, people having delays, but people who depend on food and heating and being able to afford all these bills, really going to have to make some tough decisions, and maybe not having those benefits to support them.
And at that point, we'll be about 5 days from the longest shutdown that we've had. So
Exactly.
very important to watch these markers, these potential pressure points. Lisa Hagen will be following them at ctpublic.org and ctmirror.org. Lisa, that was tremendous. Thank you so much for doing this for us.
Thank you. Hope I demystified it a little bit.
You did. That was a lot to get through. But coming up after the break, we'll talk about police use of force and the impact it has on Connecticut residents. What are your criminal justice solutions? Call now, 888-720-9677, 888-720-9677. Call us or hit us up on our YouTube stream. You're in the Wheelhouse. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. Not all of Connecticut's residents are policed equally. New data shows that police continue to use force on certain segments of the population at higher rates than others. Joining us now to explain what this data tells us, Jim Haddadin, investigative editor for the Accountability Project, Connecticut Public's, not Republican, Connecticut Public's investigative reporter team. Jim, thank you so much for for jumping in today.
Glad to be here with you.
Yeah, hopefully I'll wake up during this segment. I apologize. And also with us, Kenneth Barone, project manager with the Institute for Municipal and Regional Policy, the IMRP at the University of Connecticut. Also managed the Connecticut Racial Profiling Prohibition Project since 2012. Ken, thank you so much for being here.
Great. Thanks for having me.
If you have any questions about our state's policing, give us a call, 888-720-9677. We can have a big-time policy conversation here. I've talked to Ken, as has Jim, for the last few years about this work. So very important work. Let's hear more about it. Jim, you recently reported on how Connecticut police are using force on the job. Force meaning many things, from pointing guns at people to subduing them with electrical shots. Researchers have been collecting data on this now for several years, including obviously what Ken's doing. Can you walk me through some of the major findings?
Sure. So this is a really novel initiative that Connecticut has set up that's been underway for the last several years, directed by Ken and his colleagues. And police departments around the state are required to now report into a centralized repository when they're using force. And it's something that Connecticut does and virtually no other state does at this time. And so it's allowed us to have insight for the first time in a really comprehensive way into how these encounters are playing out. A few major findings. One is that we think that the use of force is relatively rare when police encounter people. It's a little hard to say because, again, we don't really have a huge corpus of data to look at from other places to benchmark this. But Ken and his colleagues found that about 1.6% of the roughly 100,000 arrests that happen in the state, there's some type of use of force. In terms of diving within the numbers, we do see a racial disparity in how use of force plays out. Ken found Black people are subjected to force at a higher rate compared to the rate of arrest. It's 41% of subjects in use of force incidents were Black compared to 34% of total arrestees. So overrepresented in that number. For white people, you can kind of flip those numbers around. White people were underrepresented, 56% of subjects compared to 63% of arrestees. So obviously, that is a concerning finding that deserves some further attention, and I think that's work that folks at UConn want to do in the future. And then one other number that really stood out to me, because we did some reporting on this a few years ago, is that a really significant share of these incidents involve someone who the police observed and believed to be in some type of emotional distress, and that those incidents present, a higher likelihood for injury, something going wrong. And so it's another matter that really deserves some public policy attention.
And so to get that information, you talked about police officers having to input data and not necessarily data, but information about each use of force and things like that into a computer, right? So, I mean, they're going to have to actually talk about the outcomes and certain things. What kind of things are they implementing to as they're reporting in what's happening?
Yeah, this is the data collection process is really fascinating, especially for somebody who loves data stuff like me and Ken. And it's been an evolving process that I'm sure he can talk about. It started with kind of putting this in a standardized paper form. I think they're now at the place where police departments are able to use electronic system to input this. But it's a really comprehensive look at how each encounter played out from the perspective of each individual officer that was involved. And goes into their perceptions at each stage, what happened as they moved through this kind of force escalation from perhaps issuing a verbal command to moving on to striking someone or using more serious force than that. So it allows you to know not only kind of the bare outlines of what happened, but what the officers were kind of thinking and understanding about the circumstances as they unfolded.
Sure. And that's very important context. This is where I'm going to bring you in, Ken. I want to think about it this way. The collection of this data and the way that you all do this work, one nuance to it is that if you looked at University of Chicago data, I think a few years ago, that I actually sent it to Ken and I asked him about it. When you look at this data and you talk about maybe even FBI crime data or something like that, it might show disparities, but it might also not give you the full picture, or they might not be collecting the data properly. And it might not help you when you're trying to argue in front of lawmakers that you need to see some kind of change. But this is where your kind of group comes in and does the work sort of the right way. Can you help us understand what it takes to do that effort?
Sure. There are 96 towns in the state of Connecticut that have their own police department. We have 169 towns. We have 13 special police agencies. Those are the tribal police, university police, DMV have their own police. And then we have the state police. We have about 8,000 police officers across those 100-plus police departments in the state of Connecticut. And when we started this work, they all did things a little bit differently. They all collected information on force incidents differently, and each department defined force differently. So, for example, when we started this in 2019, the Hartford Police Department would send us a use of force report every time they placed handcuffs on a subject. No other force was used, but they physically touched a subject in order to put handcuffs on them, and they counted that as use of force. I'd have maybe neighboring communities that, unless somebody was physically struck or tased or had a gun pointed at them, they would fill out a use of force report. So we spent a lot of time over the last several years trying to get everybody, first of all, to have the same definition of force, right? So when X happens, you complete a report and you report it to the state. And even though we're one state and we're not a large state, with that many different agencies making their own interpretations of laws or programs, it becomes a bit challenging. So we had to work really hard to try to create a standard system. And again, we're one of the only states in the country that does this. The way this is done in most other jurisdictions, every police department, there's hundreds of thousands of them across the country. They determine what force is. They determine whether it's documented by an officer. They determine what they do with that data. Here in the state of Connecticut, we've standardized that, and then the information comes to us so we could try to understand, what is this telling us? Can we shape policy and practice? We haven't always been, it's a work in progress, meaning we've made significant improvements in the way this information is collected over the last 5 years. But I think if you read the report we produced a couple weeks ago, that report also tells a story that more work needs to be done.
use of force, that could mean many different things. You guys are trying to get a standard definition. Can you help us with that standard definition that towns are having to use now?
Sure. So every police officer now in the state of Connecticut has to report when an incident either does cause or may cause physical injury. And so we've defined that in Connecticut to say anytime you strike an individual with a hand, an elbow, a knee, a foot, a closed fist, as an example, so that's sort of physical combat. You use a taser, or what they refer to as an electronic defense weapon. You threaten to use a taser. That's a force. Pepper spray, OC spray, less lethal projectiles. Those are used very infrequently, but think of like a beanbag or a pepper ball, maybe. And then obviously a firearm is the most serious use of force that a police officer can use. And one of the big changes we made in 2022 in Connecticut is we started requiring police officers to report when they unholster, point, and threaten to use their firearm, even if they don't discharge their firearm, right? Because it's important to know that you were in a situation where you could have possibly used a firearm and caused serious physical injury on an individual.
This is data that you and your team have been collecting on police departments, I think since 2019, at least the actual use of force data where it now is kind of broken down by the police officers as they collect it. Can you expand on how the process differs now from previous years of collecting the data, sort of the dark days before 2019, I guess?
Yeah, so again, every department had their own form, their own system, their own definition of what should and shouldn't be reported. One of the big changes we made, which may seem small, is that prior to our engagement in this program, we knew what force police used. And so we knew that police officer told you to stop, they threatened you with a taser, and then they tased you. But we didn't know what the subject was doing, why the situation was escalating, and we also didn't know the order in which force was used. So you could look at the information and make a logical inference. Well, I told you to stop, I threatened to use the taser, and I tased you. But most of these situations aren't that clean. And so one of the substantive changes we made was to have police now in Connecticut not only report the actions they took, but they're also reporting the actions that the individual they interacted with took. So I gave you verbal commands. I told you to stop. You threatened me with a weapon. I pointed my taser at you, told you, look, if you don't stop, I'm going to tase you. You started to charge me with said weapon. I then deploy my taser, and you are now immobilized. Just understanding how these situations escalate was a significant improvement in how we look at this data.
And part of it is the collection of data and getting that. And that's kind of where Connecticut Public was in prior to 2019. We're looking at Ken Barone's work that he's doing with the CTRP3. And we're trying to understand this, and we're seeing that certain departments may be flagged for having racial disparities in traffic stops, or there's incomplete sort of information. So you can't necessarily now, what you're ultimately doing is helping departments, not necessarily helping departments. I don't want to act as if you're some sort of shepherd here, but departments now can collect sort of uniform data here, or at least everybody could do the same way, so that you can't necessarily be one police station in the state of Connecticut, which was Bridgeport at the time, was always telling us, well, we just don't have computers and we can't really get this kind of information. But now sort of you have to comply with the law. So I think now everybody's kind of uniform. I
think unfortunately in the most recent report that we published, yes, the documents that they have to complete are uniform, but the report we published still tells us a story about incomplete reporting. So, for example, the Bridgeport Police Department in the 18 months we looked at told us that they had 24 incidents of force. Now, the East Hartford Police Department reported over 100 incidents of force. It's not that East Hartford used force 4 or 5 times the rate of Bridgeport. It's that East Hartford was much more diligent about properly reporting the incidents that did occur, and Bridgeport wasn't, right? And so we're still working on, at the end of the day, the law requires that departments determine when an incident meets the threshold for reporting to the state. And we rely on departments honestly and accurately reporting their incidents, right? We're dealing with 100+ agencies. It's on the agency to ensure they're complying with the law. And I think what the report that we produced tells us is that there are some agencies that are really diligent and good about reporting, and there's others, unfortunately, that are less diligent.
But this is police accountability, just as we have all kinds of public accountability measures here in the state of Connecticut. At least now you have a report that will tell you where these incidents are happening, or at least where some people might not be complying with the data here. Do you find that with data like this, experience looking at the numbers kind of matters? So I think it kind of goes back to what I asked you about the University of Chicago or FBI crime data. You can't just throw together a set of data. You need to have the right people kind of looking at it, right?
Well, of course.
And collecting it, too.
Context matters. So, what are the big takeaways from this report? Jim covered a lot of them already.
Yeah.
Right? There are some racial disparities, right? So we continue to see that black individuals in particular are more likely to have force used against them, particularly if you compare that to the arrest data. We also know that people in clear mental health distress are more likely to be involved in a situation where force is used by law enforcement. Now, the reasons for that are complex. And so what we try to do in our work every year is to try to help policymakers understand what the data does and doesn't mean. So sure, there's a disparity, but why is there a disparity? What are the factors that are contributing to that disparity? To what degree do police have control over those factors? And can we do anything to reduce the disparity? Those are all questions we work to try to answer by better understanding the data.
Very important context to have, and we're appreciative to have Ken and Jim on the show. We're going to take a quick break. This is Frankie Graziano for the Wheelhouse. We're going to explore how Connecticut's police officers are responding to this data. Are there reforms, though, that you'd like to see when it comes to police use of force, or do you think that things should maybe go a different way? Give us a call, 888-720-9677, 888-720-9677. You're in the Wheelhouse. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. A new report from the Institute for Municipal and Regional Policy at UConn analyzed police use of force incidents across the state. They found that there are racial disparities in how municipal police use force. They also found that a significant share of incidents involving people with mental health challenges are responded to with violence. Still with me, Ken Barone, whose team spearheaded the collection of this data. Also with us, Jim Haddadin, investigative editor at Connecticut Public. Jim, you shared earlier that people experiencing emotional distress are being policed more forcefully than some other groups when you look at the data, or at least at the disparities in the data. Can you talk to me about some of your reporting on this issue? And I know you did the reporter's notebook on this, and it's kind of what's piqued your interest. Can you just help me out kind of how the police departments across the state are approaching this problem?
Sure. This isn't a subject that we did some reporting on a few years ago when Ken and his team put out their first version of this look at this data, and found back then that similarly, the finding is that of the incidents that involve use of force, a significant share of those involve a subject who the police believe is in distress. They use this term emotionally disturbed, but it's someone that they kind of get on scene and it's clear to them that it's somebody who is going through some kind of mental distress. And we looked at it at the time and started to understand some of the models that police departments in Connecticut specifically are experimenting with to try to better address these situations, because they do involve, they present the opportunity for injury and for risk both to the police who are there and to the subjects. And part of that is, if you look at the latest numbers, they categorize that something like only like 6% of the time they perceive the person involved to be non-aggressive, which means most of the time that police are showing up and finding someone in this situation, they are feeling under threat. And so you can see how a situation like that is one that you want to de-escalate or try to find some way out of. So Connecticut police are trying a few different things. There is a long-standing program to train police officers to handle these situations. They call it a crisis intervention training. And a really significant number of police in Connecticut have been through that program. I think it's more than 5,000 as of a few years ago. So that in a lot of departments, when they get a call like this, you have people who have specialized training who are called out to the scene. And part of it is, they can recognize, particular signs of particular distress. But also, one of the trainers from New Haven told me it's a way that police can also just generally become more empathetic to people who are in these situations, and that can, maybe produce different outcomes. More recently, we've seen some real novel experiments around things like social workers being involved in the response. CHR works here with some of the departments around kind of the greater Hartford area. And so you might have a social worker from that organization who comes out with the police department when they get called out to one of these calls. We also have models where a social worker is embedded right into the police department. We went out to Waterbury and observed one of their social workers working on cases, and they'll do things like, if they're hanging around the office, they'll look back at what were some of the 911 calls that we got in the last week. And they'll say, do we recognize any of these people? Can we call the family and see if we can give them supports? Or they'll go out to the scene themselves. And then I think the most progressive end of this, we have departments who are experimenting with having an alternative to the police department. So you might have peer responders or social workers, clinicians who will go out to the scene so that you don't have an officer there in a way that perhaps might not present the same risk of escalation. So one area where that's been successful is right here in Hartford with its HART team. That's the Hartford Emergency Assistance Response Team. They partner with Capital Region Mental Health Center, the Community Renewal Team, and Wheeler Clinic. And some of those staff will come out to nonviolent calls for service. And the mayor, had an event last year to celebrate what a success that's been for the community.
Any success stories, really quickly, of at least police departments that are like, hey, we want to know a little bit more about the data, or maybe it's some of these departments that he's talking about that are trying to try to make sure that they could kind of work on their efforts to police the community. Is there anybody reaching out and trying to work with you all very closely?
We've seen over the last 5 years a number of departments across the state start to integrate social workers into their agencies. Madison, I think New Haven, Willimantic are good examples of agencies that have really invested in trying to bring in other professionals that can deal with people in clear mental health distress. And I think it's important for people to remember Connecticut police officers, believe it or not, go through some of the most hours of training of any recruit in the country, over 1,300 training hours. There's states, for example, down south that officers get 400 hours of training and sent out on the road. But we also have to be mindful that when we train police officers, they wear a duty belt. And they've got a taser and a gun and a baton and handcuffs, and then we send them to the scene of people that are in clear mental health distress. And then sometimes we're surprised that they use the tools that we give them and that we train them on. And that's the model, right? And so, when we look at, I'm not surprised to see a higher share of force being used on people in clear mental health distress. We also see from the data that they're more likely to be armed or threatening themselves or another individual, and the police show up and they use the tools they've been given. And so some of what I think the data tells us is we need to find a way to help that population maybe before police intervention.
You mentioned Madison. Shout out to Jack Drum, the chief there, that was very helpful in showing a young reporter about some of these body cams and ways that they were trying to work on their policing efforts down there. We do have a caller here who has concerns about the self-reporting component of data collection. Kwasi, you're on the air. Go ahead. Share your concerns. And maybe Ken can help us.
Hi. I just really want to commend Connecticut Police Department for these efforts ahead of the rest of the country, as you reported earlier. That really shows in the society we live in here, Connecticut has a very good, relationship between the people and the police that work here. And I've lived in other states, and it shows. My concern, rather, is that if you are collecting data to understand the situation, you need to collect the data from both sides of the participants. In my view, you collect the data from the police and then collect the data from the person who was, the recipient of that force, meaning the person that a taser was used on, for example. Else, you have a situation where there's a domestic abuse situation in a couple's home, and police go in there and talk only to the man and collect data on the man and come back without collecting data on the woman. So you have a full picture of what happened there.
Kwasi, I appreciate this because it's a good way to advance the conversation here. Thank you so much for your call. I'm gonna kind of put this to you now, Ken. Is that how's that possible? Could you then reach out to people who are actually being involved in these use of force cases? Would it involve them filling out the same kind of survey? Is that something you've ever explored?
Well, look, as a researcher at a public university, I always think the more data, the better. So
you're crazy.
Brilliant
but yes,
idea,
thank you for that.
Right, but
somebody's got to do it.
but there would obviously be challenges in terms of trying to actually gather that data. I think we do have the advantage.
What are those challenges?
Well, the challenges are finding the individuals, their willingness to do it, having the capacity. Right, look. This is run on a shoestring budget at UConn, and it's me and one other person, and we're trying to manage thousands of use of force reports coming in on a regular basis. And then, you'd really need the resources to build out the capacity to even try to randomly sample a number of individuals in each department that had force used against them. It's a brilliant idea, one that we should explore, and certainly one that should be posed to the legislature as, look, there may be ways to think through this. Probably not going to be able to survey everybody. I do think one of the advantages we have in 2025 are body cameras. So we can do more than we could even 5 or 6 years ago, where we were just getting the officer's perspective. Now we can also look at body-worn camera footage and see for ourselves at least more of the context that led to that incident.
Nothing you can't do, though. And that's a good question, though, by Kwasi, and I appreciate that perspective. Hey, some context from State Senator Gary Winfield, who I spoke to, who was a sponsor of the 2019 bill that paved the way for this data to be collected. Winfield says he wanted to highlight a set of incidents where mental health condition didn't really allow for civilians to respond to police in a way police would maybe like, and that's kind of what we were getting to with Jim, and of course now maybe having new ways to respond to things. His hope in collecting this data was that ultimately it would demonstrate through the data that there would be the impact and maybe then an impact on training going forward to reduce those incidents. What does this data demonstrate to you, Ken, and could it spur change in state legislation or at least maybe the way that police police?
First of all, I think one of the biggest impacts of this program and of this data collection effort is the same thing we saw when we started to collect data on traffic stops, right? Transparency changes behavior. Just the act of filling out the report, knowing that somebody within and outside your agency is going to look at it, knowing that somebody is going to try to better understand your thinking, will change your behavior in the future. And so that, to me, is still your biggest return on investment, right? Transparency. The more transparent we can be about what police do and how they do it, the better, I think, we see police respond. And I also think the better public policy we can make. We're no longer operating in a world of anecdotes. Well, somebody tells a story, this happened to me. Stories are important, But what's also important is to understand if that was a one-off or if there's a pattern or a practice of a certain type of behavior occurring, or where policymakers need to focus. So what the report tells us is they clearly need to focus on individuals in mental health distress. And are we doing enough for that population? Is the amount of force being used small or large, depending on how you look at the information?
In future rounds of data collection, I want to ask this quickly and then maybe get 30 seconds for you to respond. What additional information and data would you like to access? Maybe it's more honing in on the situation you were talking about, but are you going to need more resources from the state to do this? And then what kind of data are you looking for?
We made one really big change started in October. Police will now tell us what happened to the individual after the force. Did they arrest them? Did they send them to the hospital as a part of a mental health call, or did they do something else? That was a piece of information that was missing. There's an assumption that everybody was arrested. A lot of these people are very likely ending up in the hospital on a 72-hour mental health hold. And the other thing that would really round this out is actually information on arrests that don't result in force, because you need a comparison group. I want to know that for everybody that was arrested for burglary or robbery, 5% of those people had force used against them. And then were there racial disparities within that? So the piece of data that's really missing is actually not the force information. It's all of the incidents where police choose not to use force.
You've been listening to Ken Barone, project manager with the Institute for Municipal and Regional Policy, IMRP, at the University of Connecticut. He also has managed the Connecticut Racial Profiling Prohibition Project since 2012. Ken, appreciate you coming on the show so much.
Thank you.
Also listening to Jim Haddadin, investigative editor for the Accountability Project, Connecticut Public's investigative reporter team. I want to point you to some recent reporting that they've done, too, on a terrible situation happening out of New Britain. Please go to ctpublic.org for more on that reporting and check out him and Maysoon's Reporter's Notebook. Today's show, produced by Chloe Wynn, a dazzling program. It was edited by Patrick Scahill. Our technical producer is Dylan Ray. Special thanks to Tess Terrible, Megan Fitzgerald, Connecticut Public's visuals team, and our operations team. Download the Wheelhouse anytime on your favorite podcast app. I'm Frankie Graziano. This is the Wheelhouse. Thanks for listening.